One of the questions I get asked about a lot is, what about resection? What about fusion? Why do one versus the other? In general, the reality is most of the time, both work well. So in the way I like to think about it, if you have a space, there's no rubbing on that bone, so no pain. It's completely fused through. There's also no rubbing because it's moving as one big unit, so no pain. Just when it's that wrong amount of motion that you get this painful bone grinding on itself is what defines a painful Bertolotti's joint. So ultimately, I believe that both a fusion and a resection can work really well. However, my opinion, why do a fusion if you don't need to? One of the potential downsides with a fusion is that it starts this domino effect of needing more surgeries. When you hear about one person having a surgery that led to another, 99 times out of 100, it's because someone had a fusion that caused the spine to stiffen up more. The next level has to absorb and work twice as hard as it wants to. That level breaks down, then you fix that one. Then the next level breaks down, you fix that one. That's what I mean by a domino effect. The nice thing is with a resection or creating that gap so there's no painful bone grinding on itself, I don't want to jinx it, but I haven't seen someone need a subsequent surgery after that. The reason for that is we don't mess up any of the body parts that your body needs. So the disc is healthy and we don't disrupt that. These joints in the back called the facet joints, also we don't disrupt that. Essentially, it's taking away bone that your body never wanted and fixing the pain. Because of that, that's why I recommend a resection. I don't want to start that domino effect. And also, icing on the cake, a resection in general is a quicker and less painful recovery than a fusion.